Hi, welcome everyone. I'm Mike Webb with Equality Federation, and welcome to ANEA on the Air. Just quickly before we get into our conversation today on the Tennessee's rejection of CDC funds, this is with Act Now End AIDS. Act Now End AIDS is a national coalition of community-based organizations, health departments, national partners, and activists committed to ending HIV epidemic in the United States. ANEA on the Air is a monthly web series that covers topics broadly related to HIV epidemic. As we all know by now, health officials in Tennessee say they will reject federal funding for groups that provide prevention and treatment services to residents living with HIV and highly impacted by HIV. The Tennessee Health Department will no longer accept grant money from the CDC earmarked for testing, prevention, and treatment. As of May 31st, community organizations and nonprofits that received funding from the Tennessee Department of Health for HIV/AIDS tracking, treatment, prevention, and treatment, will no longer get those funds, according to emails obtained by the Commercial Appeal and interviews with these organizations. It's an estimated 20,000 people in Tennessee are living with HIV. Though not all will be affected by these cuts, there was no further guidance on how the state planned to fund such programs on its own as of its initial announcement earlier this year. Thankfully, we have the following experts and guests who will help us better understand what's going on and what we can do about it. So I would like to thank Will Ramirez, the Public Policy and Advocacy Manager with Southern AIDS Coalition, Rosa Barber, Chief Operating Officer with Peas Incorporated, Eddie Wiley, former EHE Coordinator with the Tennessee Department of Health, and Krista Thayer, Director of Outreach and Prevention for Friends for Life. And please correct me if I mispronounce any of your names. So I'm going to get right to our discussion today because, we only have an hour and it's just so critical for us to have a better understanding of this. What was your initial reaction when you heard Tennessee was cutting federal HIV funding?
Oh, I want to answer that one. Oh, child. So let me tell you. Okay, so it was a normal day for us. We were doing what we do. Got an email probably around 2 p.m. that afternoon was saying, hey, yeah, the funding has been cut because for months we had been waiting on contracts to come through because we get yearly contracts. And we were reaching out to the people who were in charge of the funding distribution. And they was like, hey, we haven't received anything yet. So we're like, okay, this is getting weird because it's December now. Mm-hmm. And we start the new contract year in January. So we were just got the email randomly and no one had any answers. It was just this blatant email just saying, hey, in May 31st, everything is over with. The governor said that he's not gonna fund, and we just sitting here like, what? And then the person who sent us the email was like, I don't have any answers right now, but if you have any questions, reach out to me. And I'm like, if you don't have any answers, how so it was a major shocker when that email came in that day. It was like a halt, like a pause in life for us when we got that email.
Thank you for that transparency, Rosa. What are other reactions and thoughts that happened?
We were immediately filled with a little bit of dread, to be honest. I know we're going to get into the details later, but just the snowball effect that could happen with no HIV funding in a place, Shelby County, that's third in the nation for HIV infections. We had just built momentum into getting cases lower, incidences lower, and then this happened. It's mind-boggling. We didn't know why. And like Rosa said, we had no answers.
Yeah. It was definitely shocking because I'm not a directly funded entity. But when I received the notice that we were losing the funding, it was really confusing because I was like, maybe this is April Fool's. It's January. This has to be some kind of joke because I remember putting all of the organizations at the forefront of our deliverables, making the organizations see that we were trying to not be this ivory tower in the sky, and to see that all of that work that we have been doing as employees for the state of Tennessee was kind of just coming to a crumble. So that was very disheartening to know that the funding will be lost, as well as just going along with the reactions of everybody else. Anger, I will say anger. I was trying not to say that, but I was very angry. So those are my initial ratings: shock, disheartening feelings, and feelings of anger.
I really appreciate all of your transparency. I am also curious about how did your communities that you serve reacted when they, because we all heard it. It was like broadcasted on CNN and everything. How did communities that you serve react to this as well?
So I wanted to jump in on this one and kind of connect it to the first question as well. So with Southern AIDS Coalition, we are a regional organization. So we're not direct services. We're not on the ground specifically. So our concern was really how this decision, how does it impact our communities within the South, and then our partner organizations that we work hand in hand with. So when this news dropped, our initial plan of action was information gathering, connecting with our organizational partners in Tennessee, and then trying to strategize how we're going to create advocacy to address this directly, and then also engaging with national partners to see how are they going to be engaging with community in Tennessee, because we know that this was not a fight that they were going to have on their own. We had to be there to support organizations in Tennessee, advocates in Tennessee, and overall people in Tennessee.
Thank you for that, Will. Thank you so much. And I just heard basically a lot of trauma was initiated based off of this announcement. How will this development impact your organizations or any of your partner organizations who may be affected by the loss of funds?
So with us, with PEAS, we are small, community-based. We have 4 employees who are who's dependent on this job, not just as employees, but who are a part of the community with lived experiences. So just them having to digest that, and to be honest, when myself and our CEO got the email, we was like, okay, what are we gonna do? Because how are we going to tell this to our staff who's dependent on this funding, not just for themselves, but also for their families, because we serve people of color with lived experience. And with PEAS, we are untraditional, meaning that we serve people all times of the day and night. So we don't have like a cutoff period. By us not having this funding, we don't have additional fundings. We don't have donations. We don't have any of these things. So we were immediately in survivor mode, trying to find grants to supplement what we're going to lose, because this was 90% of our funding. And so it wasn't about how we felt, because it was about the people that we love. The people that we love dearly, that we hold dearly to our heart, was going to be the ones who's affected with this. And I'm sure Krista and Eddie, can agree with this. Like, we build communities and we build relationships with the people that we serve. It's not just people we serve. We actually have love and relationships with these people. So when they're family. So this was just we could not just think about ourselves. It wasn't about the money at that point. It was about what we were going to do to try to save our community, because we knew without this, we were going downhill really fast. Because like Krista said, and I'm going to be done, we built so much momentum behind breaking stigma and stereotype behind testing and encouraging people. It's okay to get tested. It's okay. You can live with this. All of these things, and then just ending it abruptly with no explanation. It felt like it was a bully, like someone was picking on us, basically. And so that's how I feel.
Yeah, I'm going to echo Rosa. We have to build trust in the community, because HIV testing is a very sensitive subject. Being diagnosed with HIV is a very vulnerable time in someone's life. They're filled with fear. They don't know what's next. They don't know how people are going to look at them next. It's a church issue. It's a family issue. It's a culture issue. So to do that really pulled the rug out from under a whole community. And then to attribute it to a new priority population that doesn't really need the HIV prevention was like a second punch.
Can you break that down a little bit more before we hear from the guru, Eddie? What do you mean by directed to people who are not even highly impacted by HIV?
the governor switched the priority populations over to 3 different groups: mother-to-child transmissions, first responders, and victim of sex trafficking. When it comes to first responders, they have PEP at their disposal, post-exposure prophylaxis. That's the pill you take in case you think you were exposed to HIV so you won't contract HIV, with an 85% efficacy rate. Mother-to-child transmissions with our new advanced medicines, that's not an issue anymore. And victims of sex trafficking, you test them like everyone else once they are free, once they are clear. They have no need to be a priority population for this. The communities we serve obviously need our help. They're in health disparity locations. They don't have clear access to health care. It was really mind-boggling when this decision happened.
Thank you so much for clarifying.
Yeah, and to echo what they mentioned, a lot of the services that were funded under my time as the coordinator, we funded different interventions that were prioritizing different populations aside from the populations that are being prioritized by the governor. So when we think about it, a lot of the organizations that are currently funded don't prioritize those populations. So we will lose those things for access to care or access to treatment options for folks. And also a big portion of my work as the coordinator was think about the workforce development. So Rosa and Krista kind of mentioned this. People will lose their jobs. It will not become a time where we can say it's not going to happen. I remember one of the deputy directors came and was like, well, you know, everything's going to be fine. Folks won't lose their jobs, this, and this. And I had to ask him, when are those contracts are going to be renewed? What's going to happen? So not only will our communities that we serve lose out from these services not being funded, but we will also have our HIV community losing out on their livelihoods, on their work that they do. It takes more than passion to do this work, especially when we're already not having folks at, you know, livable wages. So now we're taking away that wage that they do have. So yeah, it's the community will suffer from this decision.
Thank you for that elaboration. I've heard a lot about how, like, it's in some of your organizations, this could impact up to 90% of your funding. There's job security concerns. There's relationships that you all built with community that might be damaged. Let's talk about a little bit. Yes, absolutely. Let's talk about a little bit more about that relationship with community. How could this impact the communities you serve, especially Black and Brown communities who are disproportionately impacted by HIV, who's no longer a priority population now?
Let me tell you, people aren't running to the health department. I'm just gonna be honest, because they're looking and they're seeing people that look like them, people who in their community. Like I said, there's that stigma and the stereotyping. There's a wait time. People, like, no one likes to be in a queue. So that's gonna impact that, because no one is going to be going to, you know, the health department, and those are one of the ones they're saying that they're going to keep the funding into. What we provide as community-based organizations is that outreach portion, which means we go into the communities, we go into the homes, we go to the churches, we set up, we do all of these things to make it accessible for those who's just around the community, probably not even thinking, okay, let me take an HIV test. But if you have that available, they're like, oh, okay, go ahead and do it. And if you throw in a t-shirt or whatever, then they like, oh yeah, let's really do it, because everybody like a t-shirt and a water bottle or whatever. But that's not the point. The point is we make it accessible. So my fear is, because we don't have those people going into the communities who work in who's doing the outreach part of the, you know, testing and everything, making it accessible, that the rates are going to continuously increase. People get this misinformation from social medias. Everybody has access to TikTok and all of these things. I can't tell you the questions that I receive from my nephews and nieces about information they receive from TikTok and you know, everything. So that education portion is going to be gone. The accessible testing just being posted somewhere, you know, where we offer testing for someone walking up, all of that is going to be eliminated with this funding going away.
I'm curious about how, because we talked about community. We've talked about how this impacted organizations. Will, as a funder, how has this impacted funded organizations?
Well, it's going to impact them directly. And I wanted to add a comment to what the rest of the panel was saying. Was with organizations, and you kind of touched upon this, Mike, with organizations losing around 90 to 100% of their funding, that was the original conversation we were having with organizations as soon as this news dropped. We're engaging them, and we were talking about how, you know, some of these organizations are going to lose the majority of their funding. But even if these organizations lose 50 to 60% of their funding, that impacts them to the point that they still have to close their doors. So how are they going to pay their staff? How are they going to continue doing other services? This funding supposedly only impacted prevention and surveillance. But with organizations receiving 50 to 60% of their funding from prevention and surveillance, it heavily impacts the care and treatment portion of their work as well. So even though it was strategically, you know, just to impact one type of funding, what it ended up doing, it ended up impacting organizations to the point that these organizations are going to have to close their doors, essentially.
That's tragic and an attack on so many communities, and we should start labeling that. This is an attack on community. They know exactly who they are attacking by doing this. I know we have a very wise viewer on Facebook who is curious about how this would impact HIV criminalization or decriminalization efforts in Tennessee.
Well, it's all tied together, right? Organizations work together in coalitions, including the HIV Modernization Coalition that works on criminalization with HIV. So when we go to give care and we go to talk about stigma reduction, it includes laws. And these laws are huge. When someone is arrested for, let's say, sex work, and let's be clear, sex work is real work. And a lot of people who don't have access to a good job or any job, they resort to sex work. So when they can't know their status, when they have to go to work and something happens and they don't disclose, or even if they do disclose, sometimes they're entrapped into this and they are arrested and they're found to be HIV positive, they have to register as a sex offender for the rest of their lives. And the work we do helps to keep them from having to go through that. It's all connected. And I feel like, I'm not going to say it. It's going to sound a little conspiracy theory. I'm not going to say it. I'm just going to say I don't know why they made this decision, but a lot of things are connected.
Oh, we know why, but I could be with you for now and not name names and say why. But thank you for that clarification. So what I heard was, you know, if we don't have the ability to treat people, then we're putting people in vulnerable positions to be criminalized. And also the same organizations that potentially are helping decriminalize HIV in Tennessee may not even have staff soon to continue those efforts. Did I hear that correctly?
To your point, Krista, you know, we have to acknowledge that Tennessee sits on the intersection of multiple legislation policies that criminalize people living with HIV. You know, they are one of 25 states with HIV-specific criminal laws. They're one of 9 states with sentencing enhancements, and they're one of 6 states that may require registration as a sex offender from criminalization of this. So these are important facts to understand about Tennessee and also the rest of the South with criminalization.
Just to elaborate on what Will is saying, he's absolutely right. And when Rosa and I'm with Friends for Life, by the way, and I'm with the outreach location, the Haven, we do HIV testing in many different places to bring it to the people. So for those who don't have ready access to it, we normalize it. So you can go to the farmer's market and get tested. You can go to the bar and get tested. You can go to the library and get tested. We make it easy for you. So to take that away takes away people being able to know their status and then disclose their status. Because if that doesn't happen, it makes it easier for them to be arrested on a charge that's an HIV criminalization charge.
I hate to say it, but this is ridiculous. Can you all elaborate even more what is happening on the ground? Like a general status update since the funding cuts were announced earlier this year.
Yeah, so there were some movement in legislation around folks or legislators trying to get the state of Tennessee to actually accept the funding. And if I'm not mistaken, it failed on the 28th of March. So that was something that we were really hopeful for. But unfortunately, that did not move. But I do know that there is movement on the ground from organizations that are also trying to rally around. So we've had town halls, we've had individual meetings for folks in the community that are not funded. We've also been rallying as well to see how can we assist organizations. So it's really important that we all come together now, as we've been doing, because we have that momentum to really make a change and push the movement forward. Now we are really in this movement because, like others mentioned, there's more than just the HIV funding that is affecting Tennessee. So we have to add that into the pot of everything else that we're fighting in the state.
Mike, I will tell you, we meet together. I'm sorry, Rosa. And Rosa's a part of these meetings. We meet together because we don't want to be blindsided by anything else. We want to be a united front. There is some transparency around only 6 organizations in the state will be given funding for the HIV prevention and surveillance. And that's not fair, because it leaves out the little organization, it leaves out rural areas, and we need everybody to stop the epidemic.
What Krista said.
Yeah. I'm sorry. Go, Rosa. I'm sorry.
Oh, I just said what Krista said, and like she said, one thing about Tennessee and our organizations, we communicate. We are in email chains. We are like, if one person hears something and another person, then we are connecting. I think when we did PBS came and did a special on us, and we did and someone sent this rude email to one of our partnering organizations, and she sent out a message and was like, hey, if y'all get something from, like, just the warnings that the attacks that we were getting. And then on top of that, when they started, the attacks with that, and then they passed the law that they made the drag shows illegal, and all of these things that were just coming back to back. It was like a domino effect, and it was like, what the crap is, what's going on? Like, and it just felt really, just crazy. It still feels unreal and crazy at this point, because it's like, we can't believe that we've made it this far, and now we could lose everything in May. It's like crazy. It's, oh my God.
It just highlights the importance of our advocacy being very intersectional, because if we don't see it, they definitely see it. I think we have another wise viewer who's asking, will advocacy by those 6 agencies end once they agree to accept some type of funding?
Me personally, I don't think so, because like I said, we're in this together. So what we've experienced is, like, when Krista or like any of the part are out Memphis, if anyone hear anything about funding, they instantly send recommendations, they send RFPs. We are still in this together. And then we all came to the point where if we have to partner together and use each other as MOUs and all of these things, we're going to get the job done, whether they want to help us or not. So I know the advocacy between our organizations will not end. It will only create a stronger bond where we will do what we plan to do, which is ending the epidemic here in Shelby County. And we're going to continue this fight until we can't fight anymore. That's why we're here as advocates. We're advocating for ourselves, for the people who look like us, the people we love, and also the organizations who we partner with. We're tied together, and no, it's not going to end. I appreciate that question. I appreciate it.
Rosa, you are a breath of fresh air. Any other response? I know, Will, you have thoughts.
Yes, and I want to commend the community in Tennessee and advocates in Tennessee, because the advocacy coming out of Tennessee has been robust and has been amazing. The collaboration between organizations has definitely been apparent, and it has shown to be a great example to the rest of the states in the South that may in the near future face something like this. So definitely want to share the flowers there. In terms of the question from the audience member, will that advocacy end from these 6 organizations? Well, as of right now, we don't know who these 6 organizations are, because there has been no formal announcement from the state. So that being said, what happens next? We don't know what the state is requiring of them either. We don't know what is going to be asking them in terms of priority populations. We don't know if the state is going to be asking for a gag order, not to speak on anything, not to appear on any platform, not to share any information with other organizations. So that being said, we know that the robust advocacy that has happened on the ground with organizations will likely continue. What's not known is what kind of impact that advocacy will have when the decision is made, when the formal announcement is made, and all the requirements are laid out in terms of what the state is going to require of these 6 organizations.
Thank you for that. And Krista, do you have final thoughts on those 6 organizations specifically?
I know there's been talks with the state about what will happen once this funding is accepted, right? I know that there's organizations they've approached. They haven't made their full decisions yet, but the ones they have approached have told them, we're going to continue to advocate for this. This is important to us. So you can do your funding. You can do what looks like interesting special money for certain benefits, but we're going to do our work, and we're going to do it with everybody because the whole state needs help, especially Shelby County.
Thank y'all so much. I'm just learning so much from all 4 of you. So forgive my excitement. And I do want to say that Texas, or at least in Houston, we're having a thunderstorm right now. It's not new to us, but it might be a slight interruption, but we have backup plans in place. Moving on to I think is another critical component of our conversation is support needed. What support could be useful for your organization, but also I want to extend that to you as individuals who have to hold on to this trauma sometimes as you push through to get the work done.
Rosa, are you sure? Because don't ask me about support, because I would ask everybody about support, all the way down to our boutique, which is our presentation room. We don't call it a clothing closet because these clothes are cute. We do makeovers for the inside and the outside. People who want to come in and need something to wear for a formal event, a church event, or just to build self-confidence, we put them in a nice suit, a nice dress, a good haircut, and we tell them, you can keep these clothes. Because if people don't care about their self-confidence, they won't care about their HIV prevention needs. We also can use volunteers. We also need people out in the field. Pride Month is a very busy month. We want to come and have some fun and help us out so we can do some testing out amongst a huge group of people. We'll take it. If you want to donate, we'll take it. If you want a t-shirt, we will give you beautiful t-shirts so you can advocate with your clothing and your attire while giving us funds. The best thing you can also do from anywhere is to continue the conversation. When people bring up HIV prevention, you let them know that it is important. HIV is no longer a death sentence, but it's still an issue, especially for Shelby County.
Thank you for that. What else can we do to support your organization or you as a person doing this work?
I'm so proud of my fellow, I'm so proud of y'all. But my thing is, I'm sure we all have had some sleepless nights, because I know I have, just thinking of ways that we can keep this going. But as Krista said, just keeping the momentum going. It's happening in Tennessee right now, but it can spread to your state at any moment, especially being in southern states, being a red state, and being in the Bible Belt. So Georgia, Florida, Texas, Mississippi, all of these places are tied, and they're making these egregious laws come into place. And so just what I just keep praying for me, because I just pray for myself and pray for the strength of myself and my cohorts here, and the people who are on the ground literally fighting every day. Just keep us, I can just say, I know everyone is not religious, but keep us uplifted to whatever God you serve. And if you can, just continue to get the word out, that, like Krista said, HIV is not a death sentence. You can live with this. Continue to educate. Continue, if you can donate to any organization that can, help just to continue the fight, because we need it. But most of all, we just need the encouragement and the uplift, and just continue to uplift us in this fight. That's all I can say.
And I'll also echo, donations are wonderful. We definitely need those. But I'm looking at funding agencies, organizations that actually divvy out the funds. Think about Tennessee when you're creating RFPs. Maybe prioritize Tennessee, at least for now, for some of those issues. And also, like Krista mentioned, getting feet on the ground, because it will be difficult for organizations who are losing funding to keep folks in place and hired. So by having volunteers in place, donors in place, all of these folks will help those organizations stay in operation. And as far as us as individuals, also keeping the conversation going, but making sure that you stand with us when we are having our rallies or when we are doing things. Share our flyers online, share it in listservs, continue to share funding opportunities to organizations in Tennessee so that way they can share it with each other, because it will help to end the epidemic and it will help for a partnership as well. So anything that you can offer, whether it's your organization, maybe not a 501c3, but a Fortune 500 company, you may be able to offer something for Pride to say, we'll pay for your table. Whatever it is that you can do as an individual, whatever it is you can do, offering that will be of great appreciation.
I just want to say, as an individual, you want to make sure that, you know, the work is tough, right? The work is tough and it takes a mental toll on you. So as an individual, you want to make sure you're leaning on your friends, chosen, or your friends, your family, either chosen or not. And then you're also leaning into giving yourself that space, that time to be able to recover, to be able to do this work efficiently and effectively. Because if you're not taking care of yourself, it's very difficult to be able to take care of others. That being said, as an organization, I would repeat a lot of what Eddie said. You know, SAC is a regional organization, a regional partner to support organizations on the ground, but we also need support. So definitely reach out to allow us to do this work, and then reach out to organizations on the ground to allow them to do this, to continue their work as well.
And as an example of how to support these amazing organizations, I want you all to know that Tennessee Equality Project, which is our state partner in Tennessee, do have access to healing justice funds that we provide our state partners. And so if you would like to partner with them on an event that, quite frankly, takes care of you and your staff, I would love to talk more about that and how we can provide those funds. We're not a large funder, we're not SAC, but we can help hopefully provide some healing services if that would be helpful for you all. What kind of support will be required for the community specifically that you serve? We heard about the support that is needed from organizations, but what support does community need right now?
The community needs people to be understanding. They need their providers to know that we step in with case management, right? We help our clients be their best advocate when they're with their provider. And when our funding is being taken, we may not always have the means to be there for our clients in the community. So we need the providers to step in now and be a little bit more compassionate, watch your bedside manner, know how to ask questions, not just about medication, but about how they're feeling. So the community can be taken care of in a wellness, holistic way. That's the best thing they can do. We need other organizations to know this is going to put a damper on the community right now. Just the morale is going to be down. So we don't need to have a spirit of defeat. We don't need to have a spirit of fear. We need to all be together, different co-partners with working with our community. So these organizations are like Out Memphis and Peas, but it's also organizations that don't just do HIV testing, but serve the community in other social services way.
And I also think it'll also take those resources, right, for our clients, because a lot of the things that are coming up will be those things that impact folks' treatment. So maybe housing is something that will be impacted, as well as transportation that folks may have those opportunities for. So if we look at our resources outside of our typical HIV community, maybe they can be of assistance to help us in the areas that our normal HIV funds would cover. So maybe we can be innovative for our community. So the community will need our innovation and our strategizing in order to be innovative with our funding, innovative with our resources, and with our community partners as well.
So it sounds like we need to expand our allies when it comes to funding, but also mobilizing around this work. On that topic, how can ANEA, Southern AIDS Coalition, and other national organizations and coalitions be helpful to you?
Oh, I'm going to ask it anytime you give me the opportunity. I'm going to throw some numbers out there. I'm going to be transparent because it really takes all of us to do this work. For the Haven specifically, it costs about $500,000 just to do what we do in a year. salaries, right? We have to do this testing at different late hours, like P's, just like Rosa. We work all hours of the day. We're at events till 10 p.m. If someone has an emergency, like they think they were exposed to HIV and they need access to PEP, they call us. And then we call the corner, which is our sister location, which is a clinic and a pharmacy for PrEP and PEP. The corner costs about $1.2 million a year to operate because of all the lab costs and the testing they do for STDs as well. So it costs a lot to prevent more. PrEP is about $2,500 a year, right? Which is pre-exposure prophylaxis, the pill you take to keep from contracting HIV. So if people don't have their PrEP, they may contract HIV, which then costs them about $50,000 in costs if they contract HIV for treatment and other reasons. So the prevention actually saves us more as a state. So yes, donate, and we need it. It costs a lot to do this work.
And I also think about the resources that you all already have and share as well, because with a lot of the organizations, we're feet on the ground. And so it's kind of hard to keep up with some of the policies that are shared out, some of the legislation that's also out there as well. So whatever resources that may come around will be very helpful for organizations, because at this point, we're in April. By the time we're less than about a month or so away. So at that point, people are now coming to the nitty gritty of like, we're really having to shift our focus a lot. So we won't have time to look up all of the policies and things like that. So I think advocacy will also be of great assistance.
That is important to note, and thank you, Eddie, for that, because and I agree, Krista, we need to fundraise for you all, especially for our service organizations, but advocacy is always an area that also needs investment in as well. And so thank you for uplifting that, Eddie, because if without passing good laws, it's hard to get some of these items done. What do you think is going well with the response to Tennessee's decisions, or what could be improved?
Okay, I was waiting for Eddie, but Eddie waiting for me. Okay, so the thing that works well, and we've already said it, it has made us work together. We already do work together, but there's always an air of competition out of necessity. These funders, they make us compete for money just to serve our community, and that is sad. And we shouldn't have to be reaching into the same pool of money to help our community. But when this happened, we said, oh no, we're not going to be separate. We're going to stay together. We're going to share information. And it has let us know where the gaps are even more because of this great communication that's happened since this funding decision was made. And I love that, because we can see where one person has a need, we can fill it with a different resource. And to do that, we serve so many more people in the community. So that's been a good thing. And what needs improvement, I'll let Eddie talk about it, because I'm not going to be angry today.
I agree with you, Krista. Things have been improving on the side of working together and collaborating, because that was one of my biggest, I'll say it was one of my pet peeves even before I started working at the state, of organizations having to feel like they had to compete. And it wasn't always something that the organizations just, felt natural. It just came naturally because those are the funds that they were fighting for. And now I see organizations working together to talk about, how can we partner? How can we go into this as a subcontractor, or all of these other things, where it was like, I wish they had been done before, but it always happens. It takes some type of situation to get folks in order to see a place that we can work together as an HIV community. So the community has been the beautiful silver lining in all of this. So I will say that, although we do still have ways to go, but I do believe that community that we have now shows such beauty to me.
Thank you for that, Eddie. I just appreciate you both addressing that competition that exists in the field, especially around funding. And I always, as a person living with HIV, but also someone whose background is in HIV services, that always is like one of the barriers that prevents us from actually making gains within communities and preventing new transmissions. I personally believe it's a personal thought, not a reflection of Equality Federation or any other funders or anyone that supports this work. That being said, I would love, from your perspective, Will, from a regional perspective, what could be improved, but also from your perspective, what is going well?
I'm going to echo what Krista and Eddie have said. And the reason I'm going to do that is because me going into Tennessee, I was taking an outside looking in perspective, right? And from the onset, organizations in Tennessee were willing to be engaged with each other in terms of working together. But since then, that feeling has just been outpouring. They have been communicative with each other, communicative with organizations outside of Tennessee, and really engaging together and really trying to find advocacy spaces to work together, whether that's in DC or whether that's in Nashville. And that has been something that, like as I mentioned earlier, that has served as a model to how other states can create their advocacy spaces and coalition build and collaborate within organizations on the ground to be able to create efforts against whatever it is that they're fighting against.
I definitely agree. Thank you for that, Will. We're moving on to like forecasting and prevention, right? And not in terms of HIV prevention, but how can we prevent this from happening in other states, especially similarly designed political states? Was there any indication that something like this would happen in Tennessee prior to the announcement?
Go ahead, Eddie.
I forgot to unmute. There were a few things that I will say now in hindsight that I see was kind of like, oh, that was kind of like a sign. I believe it was in December where the transgender task force were notified that they were losing their funding. And so there were a few things like that. Then there were people leaving their positions, people retiring, and all of these other things. And it was kind of like, maybe there were rumblings. I that's my conspiracy theory, but it just seemed to be very, the culture, the morale was not something that was conducive to have your employees working in. So I felt like there may have been little signs that I did not pay attention to at first, but definitely when we saw the loss of funding for that, and then even with our reporting stuff, I was seeing that it was like, well, now it's very questionable. And so not to get into too much detail, but it's definitely a lot that I can look at now and say this is lining up to where you can see that it could have possibly led. Maybe I would have never thought it would be the loss of all the funding, but definitely something was in the waters, as they say.
Thank you for that, Eddie. And you should definitely have grace with yourself. You all have responded to this in ways that I don't think other states could have. I'm sorry, Krista.
No, I'm glad that you said that. We actually haven't had too many people to say that to us. Like, you're doing a good job fighting back. You're doing a good job considering the decision. And I think we are doing our very best. And I don't think there's much that could have told us all of the $10 million was going to be taken away. It was a shock. The contracts were taking a while to come in for the funding that we were needing going forward. When December rolled around and we didn't receive contracts, it's just, oh, the state's a little late on the contracts. And then in January, the shoe dropped. But we don't know how to prevent it going forward, except maybe let's be careful about who we elect, right? I want to be careful how I say that, but there are definitely different politicians who could be put in place that have more care for communities that are vulnerable and marginalized.
I think that's a powerful point, Krista, that should not be overlooked, is without being too partisan, because we're all nonpartisan here, but elections have consequences, right? And not to penalize voters, but it does highlight the importance of why voters should vote. I want to talk about in what other ways are there threats to HIV prevention and treatment show up. I'm thinking about the recent Texas PrEP decision that came out. I'm thinking about how things can heighten stigma, and what other ways do threats to HIV prevention and treatment show up?
So obviously the big one right now is the decision in Texas that not only does it impact HIV prevention, but it also impacts other preventative services. And it was a clear attack at ACA, but it was also a clear attack at, along the long line of trending legislation that we have seen that is anti-LGBTQ, that is not to be, there needs to be named. So that's number one. Now, that's as we're reeling from the decision in Texas, we're trying to see what exactly can be done. The Department of Justice has already signaled that they were going to appeal the decision by sending a notice of appeal on in federal. That was filed in federal court on Friday. So we're waiting to see what happens from that. But it's something that we all, as communities throughout the country, need to prepare for. These attacks are going to continue, and how we respond must be in a collective way. And just to highlight something else that this impacts, communities in the South, or just communities in general. There's 12 states that have not expanded Medicaid. And after the past few months, 2 states have passed it, but have not implemented it yet. So now we're down to 10. But of those 10 states, 7 of them reside in the South. So the decision in Texas with in terms of PrEP access, it's going to have a doubling effect in communities in states that have not expanded Medicaid, and preparing for that onslaught. Communities need to work together, and to create some advocacy and efforts together, and collaboration with regional partners, with national partners, and then with local partners as well. Just all working together to find solutions to this, because the only way we're going to get out of this is together.
The only way we're going to get out of this is together. Thank you, because that's so real. And I know we touched on this a little bit already, but was there anything that would have been better, that would have better helped or equipped you to respond to this at all?
I think I really asked them about like the community input, like how was this really decided upon? Who were the folks that were at the forefront of the mind? So coming from the perspective of someone who did work at the state, I think that was something that would have prepared even the folks who are currently there. Was just, I hate to say transparency, but because it's just such a buzzword, but at least some type of collaboration in there. But there would have been nothing to prepare me for the shock of saying all of the funding will be gone. So I don't know if there was any type of thing, but I do wish we had some type of community input, at least to voice our concerns about it.
I will say having maybe different streams of funding, but I'm not going to put the burden on organizations because it's not on us. The fight for HIV prevention should be everyone's fight, and the bulk of our funding being from government made this such a blow. And if we could have more community helping each other, knowing these different resources, and these resources are free, and we want to keep them free. And in doing so, we need more people in the fight, and not just financially. If more volunteers want to come out, if more people want to talk about this issue so it stays a priority on different people's minds, then maybe that would help too. Because what this has done has shown a lot of people just how important HIV prevention is. They didn't even know until they heard about the funding being taken away. So if we can do a better job, all of us together, on keeping this in the forefront of people's minds, maybe knowing just how imperative it is to keep HIV prevention as a priority, maybe things like this won't happen again, and maybe we would have been a little bit more prepared.
But I just have to say, and I'm just going to echo my thoughts earlier, I'm just still impressed with you all. It still resonates with me when you said the fight against HIV should be everyone's fight. In fact, I wrote it down and quoted you. So you would get all accolades when you see that again in the future. But it's absolutely right. And how can we not take advantage of this opportunity, but how can we use this opportunity to highlight that fact even better? Is a question that I'm now pondering on independently. I want to surface up a question from one of our awesome Facebook viewers. About whether state funding will have a community engagement requirement. Do we know that?
I have heard from some of the 6 different entities that may receive funding, they're going to work with needle exchanges, which surprised me. And just for those who don't know, my organization and others, we work with needle exchanges, also known as SSPs, syringe services programs, where those who use needles for substance use, they can go and give their used needles and receive unused needles. That way they don't share needles and potentially transmit or contract HIV or hepatitis C or anything else that's not good for them. So this funding will make it so we work more with them, those who are chosen, but that's not all we need. There's been no talk of collaborating. I also heard a little birdie say there are certain ways you can't collaborate, which makes me wonder even further, why would you do this? And that's the information I have. And I don't want there to be any stipulations on what we can do with our funding. We know how to serve the community. We do. So leave it in our hands.
Leave it in our hands. Absolutely. That could be a campaign line by itself. How can other states be on guard and proactively prevent this kind of action? Any advice to other states? Any advice to states like Texas?
I think just as others have mentioned, even looking at how I think it was the House Bill 0370 was like put out there, maybe even talking to your legislators about these things to help prevent the loss of funding and making sure that states know that the funding should be in place as well. But being proactive about what happens in your state is loosely based upon what's happening here. We are in such a red area to where, like Rosa mentioned, we have Arkansas, Mississippi, all these other places that are around us that are likely to follow suit. And we're in such a high political environment to where things are being said and done to where it's kind of like, I feel like it's just a bid for, what they're going for. And people are going so hard on it to where now we're seeing the anger from folks in place to say, we don't want this in our state. And even with our putting our legislators up to the fire, like the Tennessee 3 that were recently, in place as well, who are now facing expulsion, keeping our legislators' feet to the fire, basically is what I'm saying. I said a lot, but keep their feet to the fire.
But Eddie, every time you talk, oh Lord, I feel like it's the gospel truth. Rosa, you came in at the perfect moment, because what we're asking right now, we're asking ourselves is how can other states be on guard and proactively prevent this kind of action and happening in their states, especially purple and red states?
Yes. So I apologize for my absence. You know how technology is. But I think that how we can get this conversation continue, especially in purple and red states, is building those relationships with your political leaders, building those relationships with your faith-based leaders, all of these people, so that there could be a clear communication, so that they can understand, because there's a lot of stigma, I would say, with baby boomers, faith, community leaders. We here in Tennessee, we have done those things, but I think we started too late to build those relationships. So a lot of our leaders do not know what entails. Everybody thinks, being, LGBTQ is bad. Everyone wants to judge in everyone's way of life except their own. So that's the problem. But I think just building those relationships, understanding the agenda, getting their input, asking them what they would recommend. I just say build relationships. Relationships and communication is everything. And I feel if we started now, then you could stop it where it is, because they will know what the agenda is. They won't just have a one-track mind on just looking at, because I think what our governor and what people in the high-ups, like I said, I feel like we started too late with their relationship with them. So they really don't understand. So they feel, this population needed, and we know that's not true, but they judge you based on your lifestyle, and no one should judge anyone based on anything. You're supposed to love everyone, because what if tomorrow is our governor, knock on wood, I'm not speaking bad on him, but what if tomorrow is someone he loves, and then the situation, the conversation will change. You better believe it. So I just think we just need to have that conversation. Those people take heed. start now having those relationships, get those MOUs with your mayors, those people who could speak for you and say the good work that is happening, and just show them the data and everything that is needed to just keep this conversation going, and so that it won't affect others.
I just want to add that, and these things have been said by our colleagues present here. We need to emphasize not only building relationships with external folks, right, such as legislators and public officials. We also need to encourage building relationships with other organizations that do the work we do, and also building relationships with organizations that don't do what we do. Housing providers, housing advocates, right? Reach across sectors and build coalitions among advocates so that when things like this come down, there's already an advocacy front ready to receive it. And not one just made up of HIV advocates, but made up of other sectors that together would do amazing work. So that when legislators are sitting down with advocates, they're not just hearing it from one set of folks. They're hearing it from community, but all of community. So that's what I would envision. I think would be the best way to respond to this happening throughout the South, and also reach out to other states that have experienced this to hear about best practices. And here's where I elevate Tennessee, because Tennessee has been on the forefront, and there's a lot of advocates and organizations in Tennessee that already know what to do and would serve as amazing leaders and trainers to other states that have not yet faced this.
Yeah, I'm really, thank you for uplifting that, Will. That is such a powerful point about how can we expand our coalitions within our state to include others beyond just those who are directly doing HIV work. That is just so powerful. How much, even if someone has like a specific prejudice in mind when they talk about these type of penalizations of our community, just how amazing would it be that they have to pause for a second because they're seeing a person who they wouldn't expect to fight for this in front of them saying, hey, this is wrong. You know what I mean? Like that, and I see why you're now the director of public policy and advocacy at SAC. Any other thoughts on how can we help other states prevent this from happening?
So here at Friends for Life, we have wraparound services, right? For many different reasons. We do food security work, making sure people have enough food. We do housing work. We do a lot of these things because if people don't know where their next meal is coming from, if they don't know where they're going to lay their head at night, they're not going to think about their HIV prevention. So we try to make sure we can serve all of their needs. So we're just one organization doing that, and not every organization can do it. And we can't do it alone. So just like Will said, the partnering is so important. Look at how everything impacts another need and give what you can. That's all I have to say.
Thank you. Thank you. All right. So I know we have 2 minutes left, but the final question that we have is, are there any specific calls to action that you would like for people to remember, or any final thoughts on this particular topic?
I want to challenge everyone to continue the fight. I know it's discouraging sometimes, especially with everything, like I said, that's going on, but just continue the fight and just keep pushing. Continue the teamwork, continue the advocacy, because you're someone voice who may not have a voice at that time. They may be too weak to fight at that time. Even as advocates, sometimes we could get overwhelmed because we feel like sometimes our work is, for nothing, or, and I just, like I said, I just thank those who I am able to share this space with, because we can relate, and in turn, we can be each other's shoulder to lean on. And then in turn, we can help our community, and we can just keep that fight going. And like, we're in Tennessee, but we need everyone nationwide help. Just because anyone who's helping someone, whether you're mother, father, sister, brother, if you assist someone, you are an advocate for that person, and you are their backbone. And so just continue fighting. Don't lose hope. Sometimes it's going to be hard, but just my call to action is to continue to love, continue to fight, and continue to be their backbone.
Rosa, I love that. I'm sorry, Mike. It just got me. I am so happy to hear you say that because I talk about partnering all the time. I've only been doing this particular advocacy work in Memphis for 3 years, and I've seen a change. I've seen us working more together before this happened. This just put us into high gear. So
Yes,
partner,
indeed.
partner, partner. We at Friends for Life, we work with a lot of our trans brothers and sisters, but Peas, Rosa, they really have a relationship with them in a way that you can't even think about. We do too, but it's not the same. It's not the same everyday type of knowing. They call for different things. We have clients that way. They have community that way. In every different state, you have different CBOs that can work together like that because it's going to take everybody to do it. So if I could just encourage you to keep partnering, keep making sure you have a place to go to test, keep making sure you have donations for someone who doesn't have food, donations for someone who doesn't have something to wear, or hygiene kits. Find a way, keep your ear to the ground, and we need to support each other. And thanks for being here today.
Thank you. Before any final calls to action, I just want to make sure we uplift and thank Deja Lee for providing the space and allowing these geniuses to help us with this conversation and understand this topic better, and Act Now N8 under the leadership of Deja Lee. Any additional calls to action from Eddie or Will?
Yeah, I do really agree with Krista and Rosa. We have to stay uplifted. We have to collaborate, but we also have to keep our feet in motion. So whenever we're doing these things, it can't just be when there's something coming at us egregiously. It has to be something that we continuously do all the time. And I want everybody to also understand that there's a place for everyone in advocacy, whether you're at the rally, whether you're making a flyer, a sign, you're donating, know that you have a place in advocacy no matter where you sit in the world.
I co-sign what Eddie said, co-sign what Rosa said, co-sign what Krista said. I'm just going to add, stay informed. As organizations, stay informed, stay connected to the means of communications from larger agencies, federal, state, local, and then, stay connected to each other. And one last thing, and this is important for organizations that are local. Keep larger national organizations engaged. If they offer support, take it, right? And ensure the fact that you're always leading. If your advocacy is coming from the state, then it should be coming from state advocates, and national organizations should be there as support. So that's what I'm going to end with.
I appreciate y'all time. It wouldn't be a proper Black or Brown conversation if we didn't go over time. Thank you all, and thank you everyone who was able to watch. And please let us know what you would like to see in the future. Have a great rest of your day.